Okaloosa Aid Support and Information Services, OASIS.
OASIS has been serving the Panhandle of Florida, and it's a rural community.
We provide services for people with HIV and for their families and significant others.
OASIS and their advocacy efforts are really, really important in this time where everybody seems to think, well, we've got medicines for HIV, so it's not really a big deal anymore. But it's a huge deal. People do die from it. People suffer tremendously from it.
What they do for these people, these are people that would not otherwise have any other resources. If we didn't have our case managers, these people would be lost. They don't have anything.
So we send our case managers over there so they can see their nurse, their doctor, their mental health provider, and their case manager all in one stop. And because we're a rural area, another thing that we've started that's unique is we move that clinic around.
They have a great volunteer base, and that's another thing that speaks highly for the organization.
Oftentimes the volunteers are also clients, and they live with medical challenges and financial challenges that make you wonder how they can do anything for anybody else, much less themselves.
I've been living with HIV since 1983. I was diagnosed in 1985.
And I know some agencies that actually have a policy against hiring anybody positive. And we have, a third of our board is HIV positive, and we think, how do you represent a community without having their representation?
I'm just proud to be part of them. I mean, the work we do, I can see how it benefits people. I get feedback from the clients of how things work.
We treat our volunteers the same way we treat our staff. They're in on all of our meetings and all of our planning, and a lot of people describe OASIS as a family.
I had a female come in a few weeks ago, and she thought she was going to die. And I explained to her she wasn't going to die and how long I've been living and living well. And it changed her outlook on how she handles her disease.
I hesitate to imagine what this place would be like without OASIS, without Butch, without his staff, without the case managers, without the work that they have done. Having been involved in this for more than 20 years, I have seen how bad it can be. And I have seen people denied reproductive rights. I have seen people lose their children for having HIV infection. I have seen people spat upon. I have seen people beaten. I have seen how awful it can be.
They are just unbelievable with the amount of respect that they show people. I have never been looked upon or treated as just, a faceless client, another statistic, someone that they need to rush in and out the door.
Well, it'll never be wonderful to live with HIV, but I think OASIS has done everything that it can, and with a lot of success and power, to make this a safer place for people living with HIV to fight the uphill battle that they have to fight anyway.